Hi, Dr. Hymes. Thank you so much for joining us on Black is White Coats. My name is Nelson. Could you introduce yourself really quickly for us?
Sure. Good morning, Nelson. Robert Hymes. I'm an orthopedic trauma surgeon at Inova Fairfax in Virginia. I run orthopedic trauma and clinical research for the department.
Awesome. Thank you, Dr. Hymes, for joining us today. We have a few questions for you, and these questions will be very helpful to pre-meds, med students, residents, and beyond. So I really appreciate you joining us.
Sure, no problem.
All right, so just hopping right into it. This is a minority YouTube channel, so I want to ask you, what does it mean for you to be a black male in medicine today?
Well, it's a good question. It's a black male in medicine is like being a black male in society. I feel that there is a little bit of a, I wouldn't say a burden, but I feel a responsibility to comport myself well in all situations. And so specifically within medicine, I'm dealing with patients and with families and administrators. I've always been taught to carry myself well, to hold my head high, and so that's what I try to bring to medicine.
Okay, thank you very much for that. What is one word or phrase that describes your journey to where you are now?
I would say mentorship. When I was growing up, there were two physicians in my community, two African American male physicians who took me under their wings and allowed me to shadow them. And so back in the 70s and 80s, shadowing actually meant scrubbing in. There were a lot less rules and regulations. So those were my early mentors. I had phenomenal mentors in college at Morehouse, mentors in medical school, and so now I make that one of my objects is to mentor young people, to help them and to share my experience.
Okay, excellent. On to the next one. So you shared a little bit about some of your path. Could you tell us a bit about your pathway, your journey to medicine, starting from maybe high school?
So sure. So I've always wanted to be a doctor. I don't know why. I just always wanted to be. In high school, I had the opportunity to spend some time with a general surgeon and an OBGYN. In the summer of my junior year, so between junior and senior year in high school, I went to a program at the Medical College of Georgia, 6 weeks program, sort of introduction to medicine and biology. The following year after graduating from high school, I started at Morehouse College early in a summer science program, matriculated through Morehouse. Very involved in pre-medicine, involved in research, which really sort of started me on the academic track. The research process, the hypothesis, designing a study, trying to get an answer really intrigued me. After Morehouse, went to the University of California, San Francisco for med school and for residency. That was a big shock culturally as well as academically. Then a fellowship in orthopedic trauma at the conclusion of residency, and then into the field of orthopedics.
Excellent. If you would, could you tell us just a bit about a few ups and downs you've had, or ups and downs, victories, struggles, hardships throughout the process? I'm sure there are a lot.
Yeah, there are a lot. I think that I've been blessed, fortunate and blessed to have parents who pushed me early. I've had the good academic tools to succeed. But as I mentioned, going to UCSF was a little bit of a shock because no longer was I the smartest kid in the class or one of the smartest. Everyone was super bright and everyone worked hard. And so for the first year or two there, I really had to put in the extra work. Failed the first and only test of my life as early in medical school. So that was a shock. But I learned to overcome and improve my study habits.
Awesome.
Lots of success, lots of ups, wonderful colleagues, friends, partners, patients. I could talk about those people for hours.
Awesome. So as of now, what are some goals that you have yet to achieve? What are some goals that you have achieved? And can you tell us a little bit about those?
Okay, well, they're professional and personal goals. So personal goals, married to a wonderful woman. We have 3 beautiful daughters who are doing well in school. So on a personal level, I've always wanted to be a family man and contribute in society. Professionally, I have reached my early goal, which was to become an orthopedic surgeon. Right? That was the first goal. and I did an orthopedic trauma fellowship. I've got a nice practice set up that is heavily clinical. I do research. I also run the section, so there's some administrative responsibilities. Future goals are I'd like to continue to grow my research program, continue to grow our ortho trauma section in the department.
Awesome, thank you for that. Do you have any words of wisdom or food for thought for any high school students, pre-med students, even medical students?
Sure. Yeah. The first thing is believe in yourself. Right. You can do anything that you set your mind to, and you may have to. Don't let anyone tell you you can't do it. And so that's number one. Number two, it's work hard. You just gotta study. You gotta prepare. There will always be another party, but there's only one organic chemistry grade. So prepare, study, good habits. Surround yourself with positive people. In college, my best friends were all on the sort of pre-med or engineering track, and so we studied together. We hung out a little bit, but we put the work in. So those would be the two goals. Believe in yourself, and then work for it. Set your goals, set out a plan, execute it.
Okay, awesome. A couple more questions. So, like you said, there are a lot of ups and a lot of downs as well. What keeps you going through the downs?
What keeps me going through the downs? So I have this belief that life is not fair, right? Life's not all a bowl of roses or whatever analogy. But I have goals and I have things that I want to do. And so if you hit a bump in the road or you go through a down point, you just have to understand that's a part of life. And you need the tools to get through. Self-confidence, hard work, intelligence, perseverance, and you get through the downs.
Okay. And there might be a little bit of a bias here, but we always ask this question: what's your favorite organ system and why?
What's my favorite organ system? Let me think about that. I'm going to go with the musculoskeletal system. That is clearly my favorite system. So I like it because the musculoskeletal system allows me to work tangibly with my hands, to see improvements, and to bones like to heal. Muscles repair, and patient's function improves on a rather short time frame. So orthopedics is dealing with patients who are mostly injured as opposed to sick. So sickness and illness, not my cup of tea, but bones and muscles are.
All right. Well, thank you very much for the knowledge and the excellent interview, Dr. Hymes. Appreciate it.
You're welcome. My pleasure.
All right, thank you.